G'day, I'm Renee Blackman. I'm a Cubby woman from the Sunshine Coast and I am the CEO for ATSICHS Brisbane.
And can you just explain the acronym for that?
So ATSICHS Brisbane is the Aboriginal and Torres Strait Islander Community Health Service, the oldest Aboriginal community health service in Queensland.
Fantastic. Now, what are the main issues facing your service?
So for ATSICHS Brisbane over the last 52 years, we've probably built and evolved an organisation that worries for probably the whole of the health spectrum and the holistic care of people. So we've got quite a large complement of primary health care, a large complement of child protection and family services. We have housing, we have early education. So there are a lot of things that actually are on the horizon for the next 5 to 10 years for ATSICHS Brisbane that are becoming real priorities for people that live in an urban setting.
Can you run through what you're trying to do to address those?
So some of the things that we've done is we've leaned into, we're a community housing provider as well, and we've, I won't say fallen into it, we purposefully took on community housing provider status, purely because we needed to be that, to provide some social housing and affordable housing as well as crisis care accommodation for our women and children. That's where it all started. And then from there, we've probably leaned into that a little bit more and started to realise what our capacity is to actually deliver proper supported social housing as well as affordable housing for our mob, which is, when I say supported through a holistic care model, which actually includes a lot of the family support that people need, a lot of the living support that people need, and also the health support that people need. So a real holistic sort of care model. Yeah.
So we heard yesterday also from regional Queensland about the importance of housing and jobs and all the other things that make up holistic health, but so often get overlooked or are part of silos. Are you feeling that they're getting addressed, those silos?
I think we can address them, and I'll say this, we can probably address them a little bit better when we live in cities. We have a little bit more, ready access to a lot of the resourcing that's available. When the further west you get, the harder it gets to build things. At least when you're on the coast. Look, it's difficult to build now, purely with, there's a housing crisis, the Olympics are coming here to southeast Queensland, builders are in demand, the cost of building escalates. So there's lots of things that we worry about being a community housing provider, as well as providing all of that wraparound care for people that are very relevant no matter where you live, if you're an Aboriginal and Torres Strait Islander in this country. Yeah.
Yesterday's conversation, it crossed a whole lot of areas: self-determination, community control. We had the Minister here, we had the Director General of Queensland Health. What were your takeaways from it? What was good to hear and what are you still looking to hear?
Look, what was good to hear was the commitment from the sector in who we are and what we stand for and what we're here for, and the pride in that, the pride in the DNA of community control, the essence of it, which is self-determination, which is doing things for our mob what our mob need in the way that they need it, when they need it. It was heartening to hear the Minister. That's the first time I've heard the new Minister speak on his position when it comes to Aboriginal and Torres Strait Islander anything, but health mainly. I think he did a really good job as a ministerial address in terms of hitting the right points. I'll say what was really disappointing for me, because I've got to be true to it, I guess, is the Director General. He was very underwhelming in terms of his commitment. I thought that he was quite disrespectful and insulted the sector for work that we've been doing for over 50 odd years, a model that actually could address some of the most pertinent issues for vulnerable people. He totally missed the mark. So that's a little bit disappointing from a Director General.
Can you say a couple of examples of where that happened?
When he talked about us changing our name from community control to, because his perception was that control was a partnership, he totally missed the mark on that in terms of the reasoning behind what is a very proud governance model that we are proud to actually hold, that is very unique. He didn't see the uniqueness in it, he sort of just brushed that away. His whole demeanour didn't look interested, which is really disappointing considering that we could actually be part of the solution of a broken health system.
Any calls to action from mainstream health, other governments?
Yeah, look, I think that when you come up against, because I see him as a barrier, so when you come up against barriers like that, and we've done it for the last 52 years as ATSICHS Brisbane, and so the rest of the Archo brothers and sisters here in the room these last couple of days, we often find the barrier and we'll go around that barrier. It doesn't necessarily stop us. We haven't. You know, I talk about our patron is Auntie Pam Mam. Auntie Pam Mam was the Aboriginal nurse that opened the doors of ATSICHS Brisbane 52 years ago in Wollongabba, in Red Hill actually. And her catch cry is something that I always stand by. Nothing stops, everything must continue. So regardless of what the Director General thinks or says, we'll continue. We will continue. We've been continuing for the last 52 years.
Anything else you'd like to say?
No, it's been a great couple of days. It's always, I think there's a lot of value and strength in meeting with other Archos from around the state. This is often the only time we get to see each other in person, so it's a really great couple of days and I really enjoy it.
Oh, thank you for the time to talk to you. It's been
Thank you.
fantastic.